Hi, everyone, and welcome back to Inspired by Onika. And today I'm talking about a subject that's a little heavy, but it's very important and very necessary. So, October is the month of National Breast Cancer Awareness, and so you will see some people wearing pink. So, that's kind of a representation for people that support the cause and that's one way that people show their support. But I just urge any woman out there to please, 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 if you meet the age requirements, get your mammogram. That to me is a life saving test. Please get your mammogram. They only take 10, no longer than 20 minutes to do. All it is, you'll be standing the whole time. They will take 2 to 3 images of each breast. And, it's just a radiographic image to look at your breast tissue. So they will take 2 to 3 images, at different angles to see what's going on, inside with your breast tissue. And, the please be patient with the radiology technician because you're going to be up close and personal with a stranger who they're touching a sensitive part of your body, so that can be a little uncomfortable. And then the goal is to flatten the breast tissue as much as possible, as much as comfortably possible. So, while you're standing and they're doing the images, they will, they have a machine that will try and, flatten out your breast tissue. And they, you hold your breath, they take the image, and, they do that for each breast. The test is very quick because the last thing that you want to do is you have to be called back because the images are no good. So please be patient with your radiology technician. Like I said, you'll be up close and personal with the stranger and, they're touching a sensitive part of your body. I get it. Okay, but just be patient. You want to make sure you get the best images as possible. Okay. Like I said, this test is very quick, 10, 20 minutes tops. You're in and out. So anyone that hasn't scheduled their mammogram, you're late scheduling, call your doctor, make your appointment. Okay, and get it done. Okay, it can be life saving. Okay, another thing you can do is at home you can do your own self breast exams. You can do this either like in the shower, you can lay down and do it once a month. And the only way you'll know what is normal for your body is if you're familiar with your own breast tissue to know what it's like. So that way it'll be easier for you to detect if there's something wrong, if you notice something's different. If you're doing your self exams, you'll understand, okay, well, this is normal for me, but wait a minute, now this is not. So the only way to get familiar and to know is to perform those self exams once a month. That's it. Okay. You will just use your 3 middle fingers and you'll go in a circular motion over each breast. Whichever breast you're doing, you want to hold your hand, either behind your head or just up as high as possible so that you can, get the tissue as flat as possible. If you want to lay down and do it that way, but you just go in a circular motion around each breast and also the armpit area just to see, if there's anything that's unfamiliar or different. But like I said, the only way to know what's different for you is to go and do those self exams so that if something is a little different the next time you do it, you call your doctor, schedule an appointment. Okay, now, other things we can do for prevention or to lessen our chances are, of course, exercise, also limiting alcohol, smoking as well, limiting those things because those things contribute. And of course, there are other things that's different for everyone. Some of us may have a family history, or we don't. But those are just a few things we can do to limit, our chances of developing breast cancer. And if there's someone that you know that is a cancer survivor or someone who, has been diagnosed with breast cancer, I think the most important thing we can do is to listen. Lend a listening ear. Let them talk. Okay, let them know you're there for them. Let them know they can call you anytime if they want to talk. If, they ask you, if there's other things they ask you to do, like maybe run an errand for them or something, and that's within your means to do, please, by all means, do that. Okay, we just want you to know that we love you and we care about you. We're there for you. If there's anything we can do to help you, then then we will do that. Okay, but the one thing I will just caution is try not to say things like I know how you feel, unless you of course have experienced the same thing, because honestly we really don't know what that person feels if we have not experienced that. We don't want to give false hope, things like that. We don't want to say to them, just be respectful of what they need. Just let them know, you know, I'm here for you. Call me anytime. If you need help with anything, check in on them. Let them know that you care, that you love them. Okay. And that, you're there to listen. If just check in on them, call them every now and then, send them a text, send them a note, a card, whatever it is. Just let them know. I think listening and letting them know that you're there for them and that you care, it's very important and it goes a long way. So that is my message. Please, please, please get your mammogram, schedule your appointment. It's a very quick appointment. I know our lives are busy, but that will be the best 10 to 20 minutes of your life that you can spend. And also, let's not forget the men out there. They're affected by breast cancer as well. It's not as prevalent for them, but it does happen. So until next time, stay well and be blessed.